scenario 4. Scenario 4 states that there is a patient with a blood glucose of 328, and I'm supposed to determine how many units of insulin I'm going to give her based on a sliding scale that I was given. So I had determined that since her glucose is 328, that I will be giving her 9 units of insulin based on the sliding scale. Okay, so before I get started, I'm going to check the electronic records and make sure I get the right medicine, that I'm dealing with the right patient, you know, the 10 rights. So then after I do that, I'm going to enter the patient's room, introduce myself, provide privacy to the patient, identify the patient using 2 forms of identification. I'm going to double check the dose again. I'm going to double check the map again. And then, so then I have hand hygiene before I start anything. Or after I walk into the room, I will perform hand hygiene as I'm identifying the patient, introducing myself and whatnot. Okay, so then I'm gonna set up my station. So I have a few alcohol swabs, or alcohol wipes here. I have my insulin vial, and I have a 50 unit insulin syringe with the attached needle. My patient, I got some gauze and some tape, and so then I got everything set up. I'm going to then start to withdraw my medication. So I'm going to use alcohol swab. I'm going to cleanse the top of the vial on the rubber part, the whole top, for 15 seconds. And then I am going to pressurize. I'm going to pressurize the vial. So I'm going to take this off. And then since it's where I have to administer 9 units of insulin, I'm going to pressurize the vial with 9 units of air. Make sure that I'm in the air gap. I'm going to flip it over and make sure that my needle is in the liquid. And I'm going to draw 9 units of this insulin. Make sure there's no air bubbles. Make sure that I am on 9. Flip it over. Take the needle out. Inspect if there's any air bubbles. Again, give it a little tap if there are to put them on top. Okay, so we got 9 units in there. So then I'm gonna cap it again with the one-handed scoop. And then I'm going to cleanse the patient. So I'm going to start from the middle and do 2 inches out for 15 seconds. Allow that to dry. So this is a subcutaneous type of injection. So I will be going in. You can go in from 45 to 90 degrees, but I'm going to be going in at 90 degrees. So since I'm going to be going in at 90, I'm going to pinch 2 inches of the skin up, and then I'm going to inject the patient. Oh, the sites you can inject the patient, the sites you can inject the patient are in the abdomen, around 2 inches below the umbilicus, the trochanter, gluteus, the deltoid, the deltoid, and yeah, okay. So I'm going to pinch 2 inches of the skin. I'm going to inject the needle at a 90-degree angle, insert the medicine, and then as I release the needle, I'm going to release my hands, and then I'm going to do the one-handed scoop on the needle, cover that, get a gauze, and lightly apply pressure. You don't want to massage it or anything. I'm just gonna tape it. Okay. And then, oh, I don't know if I said this in the beginning, but I would be wearing gloves throughout the whole procedure after I did my hand hygiene. Okay, so then that's done. Ask the patient if that feels okay, if she needs anything else, or he or she needs anything else. Give them their call light, make sure they're all comfortable and settle in. I would gather all my, or dispose my gloves, gather all my supplies and exit the room, and then I would document the procedure that I just did on the patient. And that's it.